Health Month, and joining me today is Dr. Mark Richards. He's a cardiologist at Portneuf Medical Center. So Dr. Richards, first of all, thank you so much for being here today.
Thanks for having me.
So we know February, Heart Health Month, very important month, very key to kind of get some information, some reminders out there for people. So let's just talk about a few maybe warning signs or some conditions maybe be aware of, things like, let's start with AFib. Just tell us a little bit about that.
Yeah, I'm a heart rhythm specialist, and so atrial fibrillation is probably the most important issue that we deal with. More than 10 million people in the United States have atrial fibrillation. And if you're, aged 75 to 80 years, you probably have a 15 to 20% chance of having atrial fibrillation, so an extremely common condition. We care about atrial fibrillation really for three reasons. One is it can increase your risk of stroke, ischemic stroke, by about a factor of 5. And so we are always very looking very much to identify this early so that we can do things like ablate people, put them on direct oral anticoagulants to minimize that risk. A second concern is heart failure. Sometimes, believe it or not, 30% of patients are actually asymptomatic in atrial fibrillation.
Right.
And then they come in, they think they have the cold or they have the pneumonia or they have a flu. And in fact, they're in heart failure because they've been going 130, 140 beats a minute for, weeks to months at a time. And obviously, hearts don't like that and they go into failure. And then third, of course, about 70% of patients are very symptomatic with this. And symptoms can range from palpitations, atypical chest pain, shortness of breath, dyspnea on exertion, things of that nature.
And I know another big health concern when we're talking about heart health and taking care of your heart, there's something called sudden cardiac death. Tell us what that is. I know it sounds scary, but tell people what that is and what they need to know.
Well, it is scary. More than 350,000 people in the United States every year suffer sudden cardiac death. And so, and unfortunately for a significant majority of those patients, it's actually the first time that cardiac disease or heart health issues actually come to the fore for these people. And so we're very invested in taking people's complaints seriously and obviously looking to identify those patients who might be at more risk for that. Therapies for addressing that would include revascularizing the heart. So sometimes patients who've had heart attacks need bypass surgery, need stents, et cetera. That's often a cause. But patients can also have just simple heart failure in the absence of blockages in the arteries that feed their heart that places them at big risk for sudden cardiac death. So awareness is the big key.
Key of being aware, getting in, making sure you're getting those checkups to prevent all these.
Yep. And then of course it's all about increasing awareness of cardiovascular disease, and we encourage everybody to take the right steps to just try to live a heart healthy style. Yeah.
All right, Dr. Richards, thank you so much.
Thank
Really
you for the
appreciate it.
opportunity. You take care.
Yeah.